Hello everyone. Today's class we are going to discuss about female sterilization, which is also called as tubectomy. In the last class I have discussed about the male sterilization or vasectomy. So let's begin. So starting with the timing of sterilization. This procedure when we will conduct or when we will do it. The first one is postpartum sterilization. Postpartum means after the delivery. So after 24 hours to 7 days of delivery, if we are conducting the tubectomy procedure, then it is called as postpartum sterilization. Okay, if it is after delivery within 7 days. Next is interval sterilization. Interval sterilization means non-pregnancy states. Okay, it's below 6 weeks within the 7 days of menses. That is interval sterilization. Next one is post-abortion sterilization. It is during miscarriage. If miscarriage happen, after that if they'll go for tubectomy procedure, that is called as post abortional sterilization. Next one is cesarean sterilization. It means during the cesarean section, if they go or if they undergo the tubectomy, that is called as cesarean sterilization. Then there is a important point like laparoscopic tubal ligation not recommended when if tubes are vascular and edematous may get torn easily. So in that case they should not undergo the tubectomy. Next we have case selection. So first one is, it like everyone knows, it should be female because it is tubal ligation, and the age of the female should be between the 22 to 45 years. Okay, and the person or the woman who is undergoing the tubectomy procedure, she should married, at least they have one child above 1 years, and sound state of mind, like the state of minds of the person should be normal, and the mentally ill patient like psychiatric and illegal guardian. Okay, so like if the patient is having any mental unstable, means she don't know what she is going to do it, she is not stable to understand it, in that case they should ignore this procedure. So these are the selection procedure for going tubectomy. Now I'll tell you pre-procedure or preliminaries, means before conducting the procedure, what are the steps that we have to follow. In that, first one is consent. Okay, informed consent, not under coercion or sedation. Okay, the person should be stable and conscious fully, that they have to sign that they are ready to undergo the tubectomy procedure. Next, sign before surgery, and consent of spouse not required. Okay, so these are the preliminary procedure. Now types of tubectomy. First one is mini laparotomy, laparoscopic sterilization, vaginal tubal ligation, hysteroscopic and sterilization. Okay, like what are the procedure or method we have for doing the tubectomy. Now I'll tell you one by one what is mini laparotomy. Postpartum, post-abortional or interval period. See, this mini laparotomy when we can conduct postpartum period, that is postnatal period, post-abortion and interval period. And interval sterilization should be empty stomach, they have to empty the urine, local anesthesia should be given, and pre-medication, that is meperidine and promethazine, and uterine manipulator, and 2 to 3 centimeter transverse suprapubic incision is done, and 2.5 centimeter above. Okay, and postpartum sterilization, it should be given under local anesthesia, 2 to 3 centimeter subumbilical incision, 2 centimeter below the fundus, and tube identified by the fimbrial, and tubal ligation does using modified Pomeri method or clips or ring, and kept for the observation for 4 hours discharge, and antibiotics and allergics are given. As I told you, there are so many methods that they will follow for doing the tubal ligation. So I'll show you some pictures. So see, one you can see the Pomeri method tied. What they are doing in the fallopian tube, they are tying the tube. So what happened? The ovum will release the egg. It will not come to the uterus, so it will not mix with the sperm, and the lady will not get the pregnancy. So this is one procedure, tying knot. Another one, what they'll do, cut, they'll tie it and they'll cut it out. So the same reason is same, that it will not transfer, or it will not the travel, and it will not mix up with the sperm. And another one, you can see the final result, it will be detached, the pipe will be, or the tube will be detached. That's why we'll call it is tubectomy. Okay, you can see this forceps, which is called as Bob Cox forceps, which is used for the tubectomy procedure. Next, we have complication of tubectomy. First one is anesthetic hazards. That is for all the cases. If anyone is undergoing anesthesia, they have some complication related to anesthesia. Next is bowel and bladder injury. Okay, during the procedure, there is a chance of getting injury into the bowel and bladder. Broad ligament hematomas. Okay, infection, wound sepsis, and peritonitis. This is the some like common complication that is associated with the tubectomy. So with this we have completed the tubectomy, and what we have learned here, first we have seen what is the introduction of tubectomy and what we have to do it. What we have to do, we have to cut, or we have to tie the fallopian tube, so that there should be stop of traveling of egg, and it can't mix with the sperm, so the lady or the woman will not get pregnant. Then we have seen certain types in that mini laparotomy, hysteroscopy, it is based on the procedure. Okay, then we have seen the instruments that is used for the tubectomy procedure, and some complication with the tubectomy. Thank you everyone.